Hello, everybody. Good afternoon. Thank you for joining us. Before we begin our presentation, I'd like to take a moment to share our Zoom options and functions. If you give me just a second, I will go ahead and present my screen so I can take you through those. So this is a webinar. Participants will be able to communicate with us through the chat option. If you have any questions or any comments about the content, feel free to type in the chat. If you have any technical issues, feel free to message me and I will help you the best I can with those. We do have a Q&A set up. So if you have any questions for our panelists or our presenter, enter your question into the Q&A and that will be saved for a later time in the presentation when we get to answering the questions. The last thing is this presentation is being offered bilingually, simultaneously. When we have our interpretation on, look down on the right side of your Zoom options and you'll see a graded globe symbol like the one you see in this screen. Click on that and you'll be able to choose the language channel that you want to be on. You'll be on English or in Spanish. And if you want to cut back on background noise, make sure you mute original audio. If you have any questions or need any help with the interpretation functions, go ahead and message me during the presentation and we'll get you set up. With this, I will go ahead and pass the presentation over to Judith Blanchard.
Thank you, Alex. And I just want to be clear, when Alex says to message him, he doesn't mean a text. He means him in the chat. So I'm Judy Blanchard, and I'll be your moderator for today. This program today is a joint effort of the Garfield County Regional Libraries and Senior Matters of Greater Carbondale. And Senior Matters has been bringing together our region's aging population since 2008. This is one in a series of presentations sponsored by Senior Matters and the library. So if you're interested in some others, all you need to do is go on their websites and you'll see upcoming presentations. And Alex will be posting the websites in the chat. So I want to welcome everybody. And I would like to first introduce our speaker, Dr. Brooke Allen. Dr. Allen is a local neurologist. She's been in practice in our valley for the last 11 years. She has a very thriving clinical practice where she focuses on dementia, mild cognitive impairment, multiple sclerosis, and migraine. Since the COVID-19 pandemic began, she's volunteered her time as a member of the medical advisory team for Pitkin County. She's also responsible for establishing a valley-wide free COVID testing tents throughout the valley through collaboration with local and state partners. So without further ado, I turn it over to Dr. Allen.
Thank you, Judy. Just a quick note to make sure you can all see my screen. Can I get a thumbs up from Judy? Great, wonderful. Well, thank you so much for having me. I am excited to talk to everyone because a lot of what I'm presenting today is good news compared to some other experiences we've had over the past year during other presentations. But I am available to stay after the webinar for any questions that are ongoing. So please write your questions down and we'll take those at the end. So just a quick overview initially, SARS-CoV-2, which is the virus that causes COVID-19, was first noted in Wuhan, China in December of 2019. That's why there's a 19 in the name of the disease. And it is a novel coronavirus, meaning it has never been seen before in humans until 2019. And primarily it causes a respiratory, but also very consequential inflammatory illness. As of today, these are today's numbers, the United States is right under 32 million positive cases since the pandemic began. And unfortunately, we have lost just under 573,000 people to the virus. So I just want to take a second to think back over this time because we have lost a lot. We've lost precious time that we have with some of our more at-risk loved ones. We've lost the ability to hug on a regular basis, that physical touch, which has mental health implications. We've lost productivity at work while managing our children at home and trying to work remotely. We've lost the ability to travel and have the same adventures we would have always had. And then economically, families are struggling, our country is struggling, and health has declined, mental health, physical health.
Médica, la salud física ha declinado.
Especially during those first 6 months. And cognitive health, I mention here because we have a lot of patients in the clinic with dementia who have really suffered from that lack of physical contact and even proximate contact with their loved ones. Parents, children, sisters, brothers, aunts, uncles, grandparents, cousins, friends, and colleagues are among those we have lost. So where are we now? I'm going to ask Alex to drop this link in the chat. As of this week, the governor of Colorado has revoked several of the prior public health orders. And this is really good news because more and more individuals are being vaccinated in Colorado. As of yesterday, we had almost 1.5 million people fully vaccinated, which represents 25% of our state, which is fantastic. In the US, we're right at about 25%, 84 million. But worldwide, we have quite a ways to go. Right now, we're at about 2.6% of individuals fully vaccinated. So I just want to chat for a second about vaccination in the Roaring Fork Valley. Our goal is that we would have around 70% of the general population vaccinated to get us to herd immunity. That would sort of be a minimum, but especially individuals over the age of 75, we'd like them to be vaccinated at a rate quite higher, 80 to 90%. I've broken down the counties here so that you can see, and they're really right all on an excellent pace, a little bit faster than what the state of Colorado has done so far as a whole, with around 50 to 55% of individuals receiving at least one dose. And that is very, very promising for our community because we are one community. It's important that we think of ourselves as one community when it comes to vaccination and this disease. Garfield County, they are doing a little more public health administering, but I believe Valley View is still holding their clinics. And I'll give you a link here in a second to sign up for a vaccine if you don't have one already. But we're looking at Wednesdays in the Glenwood Springs office and Thursdays in the Rifle office for our public health team being able to administer vaccines. In Eagle, they continue to have regular weekly clinics, but their big focus next will be on the teen population now that we can vaccinate individuals 16 and older, and really addressing some of the vaccine hesitancy with individuals aged 19 to 29. And in Pickens County, they are transitioning from this large incident command, over 1,000 vaccines per day, and moving that now more into the local primary care office and some targeted pop-up clinics. But the good news is that everyone is now eligible for the vaccine. And I'm going to ask Alex again to drop one more link into the chat here. This is the Colorado Department of Public Health, and they are able to link you here based on your location and your desire of where you would like to be vaccinated with a sign up. form. And so everyone should be utilizing this if you are interested in a vaccine. So as I mentioned, Governor Polis's orders have been expired, many of them. There are still some in place. For instance, children will still be wearing masks in schools, but the big change has been that the requirement for 6 feet distancing and masks are really now for mass indoor gatherings with some small exceptions. The details are here, but we have those in the chat if you'd like to go through more of them. Another is that any large outdoor seated event would need CDPHE, which is Colorado Department of Public Health and Environment, approval. So that's important. And it's also important if you are planning to have a large event anywhere in our valley, just to let your public health departments know so that they can just be on the lookout for any potential outbreaks. Remaining orders also include a snapback provision that if any hospital locally exceeds 85% of their capacity within their system, that the county would need to do some mitigation efforts to get back on the right track. So when we think about COVID-19 as a diagnosis and illness, there are 3 terms that come up over and over again. One is the incident rate. So this is how many individuals per 100,000 people have a new diagnosis of COVID over a certain period of time. We used to measure this at 14-day intervals, and now we're measuring at 7-day intervals based on some state guidance that allows a little more flexibility, but perhaps a little less predictability. The positivity rate is how many positive tests there are out of all the tests given in a certain day. And then hospital stability is really based on, are hospitalizations increasing due to COVID-19 or are they decreasing? And I'll just post here, this is the last Colorado state dial that we had. Again, it is expired at this point, but these were the metrics. So you can see the different levels according to a 7-day incidence, a percent positivity, and whether or not hospitalizations are stable or are they declining. Currently in our valley, this is a quick snapshot of where we are. On the left, you'll see the 1-week cumulative incident rate by county. All 3 of our counties, according to the state, are in the yellow, meaning we have between 100 and 300 new cases of COVID per 100,000 people. The actual number is lower than that. And then the 1-week positivity rate, you can see Garfield and Pitkin are in the less than 5% category, while Eagle is hovering around 5 to 6%. And then the number of days with decreasing hospitalization. And so you'll see here that Pitkin and Eagle have been doing this for anywhere between 8 and 11 days, while Valley View has seen this decline for almost 2 weeks now. Again, in Garfield, cases are decreasing, but it's important to know there is a high rate of variance in general. As of yesterday, I believe there was 1 confirmed P1 or Brazilian variant, but most of them have been one of the UK variants or the California variants. There is a slightly higher number of cases in children than we've seen in the past. I know there are currently 3 outbreaks in schools or daycare this week alone, and an outbreak at our local jail and at the VA that's been ongoing. In Eagle, cases are also decreasing, and they're also seeing a higher number of cases in children, but most of those during sports or social events rather than school. And in Pitkin County, cases are also decreasing, but an extremely high rate of variants are present there. Over 93% of the cases are either the UK or the California variant. We know the UK is more rapid in terms of spreading. And then there have been several reinfections within the last couple of months of individuals who had COVID-19, but then were infected with a different variant of the disease and became sick again. So that is something to definitely stay on top of and be aware of. So if we did have the dial up and going, Pitkin County would be in the yellow. Their mask order has been extended through May 1st, and I expect it will likely get extended again. And they plan to continue using that dial for their guidance through at least the end of May. In Eagle County, they're currently following the dial. They're wanting applications for indoor and outdoor events, and they have some special restrictions for restaurants and gyms as well. But their plan is to drop all of the local public health precautions by May 27th, except for those that will continue to be mandated by the state. And in Garfield County, also in the yellow zone, a little bit of a wild card, but the commissioners have indicated that they have no plan for public health orders or restrictions or enforcement. And by some reports, may even be encouraging businesses not to require masks for entry. But the town of Glenwood has extended the mask order through May 20th. So we'll see, as Glenwood will be the first test really, or Garfield County, I should say, for any large events that will be happening in May of this year. Again, for now, and over the next 30 days at least, the state of Colorado is requiring mitigation by the county if 85% hospital capacity is reached. So that's a nice snapback provision there. I'm happy to say we have 3 FDA-approved COVID-19 vaccines. Pfizer and Moderna are both mRNA vaccines, one requiring ultra-cold storage, while the other one requires cold storage, unlike Johnson & Johnson, which can be stored in a regular refrigerator. The Pfizer vaccine was recently approved for children 16 and older, while the Moderna vaccine should still only be given to individuals 18 and older. The mRNA vaccines consist of 2 doses, the Pfizer one 3 weeks apart and the Moderna 4 weeks apart. And the protection is really evident 2 weeks after that second dose. We're expecting that both of those vaccines will require a booster, and Pfizer has come out and publicly said that in the last week or so. The Johnson & Johnson vaccine, which was widely distributed, is currently on hold due to a small number of rare blood clots in young women ages 18 to 48. And they had these clots within 2 weeks of having the vaccine. I do expect this will likely be lifted, this hold, and we can talk about those risks. But primarily, I think what the FDA wants to do is understand the best way to treat these clots and educate our providers in our country on how to do that. I have seen some data looking at Johnson & Johnson, and it really does appear that you may even need 4 weeks after the second dose to have your protection, but after your dose, it is only a 1-dose vaccine. And just some perspective here, the Johnson & Johnson vaccine, 1 in a million for the blood clot. With oral contraceptives or the birth control pill, we can see blood clots as frequently as 1 in 3,000 individuals. And most importantly, 1 in 5 hospitalized patients can develop a blood clot. So again, I hope everyone is signing up for the vaccine or has already had the vaccine. A quick note about vaccine side effects. In your arm where you get the shot, you can have some pain, some swelling, redness, some heaviness to that arm. And then systemically, you can feel very tired, have some fatigue, headache, all over muscle pain, even chills and fever and nausea are not uncommon. There are some rare side effects, including anaphylactic reaction, but that's extremely rare, and we do monitor patients as they're receiving the vaccine and for 15 minutes after the vaccine. So if you have any questions about that, please talk to your primary care doctor if you're concerned. Most importantly, the COVID vaccination will reduce your chance of getting COVID. And all of these side effects that are listed here, they're really normal signs that your body is building up the immunity that you need against the disease. If you didn't get side effects, that's okay too, especially if you're in an older population like me. I did not have any side effects to the Pfizer vaccine. And that's really because as we get older, our immune system doesn't work as well anyway. And so there's less of a response to be had. I wanted to just make a mention here too of our mRNA vaccines and how they're different. This technology has been developed really over the last 2 decades, mainly in the HIV community. And so it's very serendipitous that we are able to have these vaccines within less than a year of the pandemic starting. It's a pretty amazing research accomplishment. But these vaccines are different from traditional vaccines because they give instructions for our cells, to make a harmless piece of the spike protein. That spike protein is found on the surface of the coronavirus that causes COVID-19. So once that vaccine is given, that message, that messenger RNA, is then inside your immune cells, and your cells will use them to make that piece of protein. After the protein is made, the cells will then break down the instructions and get rid of them. And then the cell begins to display this piece of protein on its surface, and our immune system recognizes that as foreign and then begins to build an immune response and make antibodies. So what the end result is that our body is then able to protect against future infection at a fairly high rate. And then we can have that that protection without actually getting COVID-19. So that's really important. As we start to think about how we open back up
pensar cómo es que vamos a poder reanudar nuestras
a handful of COVID-19 illnesses despite full vaccination. In our valley, I'm aware of 18 cases, but there certainly could be more by now, and around 500 cases in the state, which represents a very low percentage of individuals who have been vaccinated. And one still unknown is, can a fully vaccinated person contract the virus, not get sick, but still spread it to someone else? And there is a study of college students that's going on right now or about to start that will really answer that question once and for all. So that will be good information for all of us. So the take-home message is that vaccines are very good, but they're not perfect, and you'll need to determine your own risk based on your environment and those around you. So a lot of questions we get in the clinic: when can I stop wearing my mask? So let's first talk about when you should keep wearing it. You should wear it if you'll be around someone you don't live with. And that can occur in any public indoor space, while exercising indoors at a gym. If you're at a public pool and you can't be 6 feet away from someone, but you're not swimming, you should probably wear your mask. The state of Colorado has mandated continuing mask wearing on public transportation or when ride sharing. Other thoughts on when to keep it on would be waiting in line, going to visit your doctor or other healthcare provider. And really, if you're unable to stay 6 feet away from someone else where you don't know their vaccination status. If you go to a restaurant, while you're talking to servers, hosts, waiting to order your food or waiting for your food, it's important to keep your mask on just out of respect for those individuals. And also I added here, it's important to wear your mask around any individual who you know to be at high risk for the COVID infection complications. So when can you take it off? Well, when you're at home. And the good news is with others who've been vaccinated. So count up all your friends who've been vaccinated and you can get together with all of them without masks, which is pretty amazing. Obviously, if you're eating or drinking, if you need to speak with someone who's hearing impaired and they need to read your lips, you should take off your mask. And if you're not sharing a common area, such as at your office, and you're not sharing with other people who haven't been vaccinated. If you need to have a procedure or a service of the nose or face, they're not requiring it for religious service officiating. And if you are delivering a speech or singing a song, the performer is supposed to be about 25 feet away from the audience. Obviously, you might have to remove it for identification purposes. And then if you're swimming, you don't need to wear a mask. And really outdoors, as long as you can stay 6 feet away from other people if you don't know their vaccination status, I think it's fine to take your mask off. So just a little bit about what makes someone high risk. The older you are, some concomitant medical history, including diabetes, high blood pressure, obesity, a history of immunosuppression, or some other chronic health conditions can make someone more at risk for COVID complications. And in my mind, what makes a situation high risk would be, indoors more risky than outdoors, especially with people who you don't know whether or not they've been vaccinated, sitting too close to the stage at a concert, indoor gyms would be concerning to me, and then certainly large events with individuals of unknown vaccination status. So what's on the horizon for the rest of 2021? Well, in our valley, we're continuing to monitor the variants and the effect of the vaccine on the variants, as well as looking at reinfection with some of these variants. Vaccines for younger children are not expected until at least December of this year. So we do expect our younger kids under the age of 12, especially, to likely not be vaccinated.
Las vacunas para quizás.
And I think what you'll see next in the research world is more work towards antiviral therapy to treat COVID-19 when it does happen, because we know it will continue to be a part of our lives, and we really need some good therapy. I just got a notice on my phone a few minutes ago that there is a new medication for pediatrics. So all of those antiviral therapies and research and development for those are super important. I would expect that there would be at least a yearly booster vaccine, and this would include the ability to augment the vaccine for any mutations that are prevalent in our country. And thankfully, the mRNA technology allows for that. I would also expect to see more vaccine passports coming to the United States, as we've seen in other countries, in Israel in particular, to enter certain events or to do certain kinds of travel. It's also important to remember this year to get your flu vaccine next fall, because we will see a small surge in the fall despite vaccination. And then some people may decide that, hey, they want to continue wearing their mask in a high-risk situation beyond 2021. I've reflected on this for myself, and I don't know that I would be on a plane or in close proximity to other people that I don't know without a mask on, even beyond this year. So those are all things that will be personal decisions as we move forward. I want to briefly touch on some mental health resources that are available in our valley. Currently, there are post-COVID recovery clinics at Valley View Hospital, Aspen Valley Hospital, and our clinic has a neuro-specific post-COVID recovery clinic. There is a COVID support group that just started up at Aspen Valley Primary Care, and that's a free group. You can find information about that on the Aspen Valley Hospital website. And then I've listed a few other options here for individuals who might want to go a little deeper and do some cognitive behavioral therapy, or they're really just in crisis and need to reach out to someone. So Aspen Strong with the website here, and our Aspen Hope Center is available 24/7 for phone call outreach as well. I also listed some telemedicine options since we're getting very good at telemedicine, betterhelp.com and verywellmind.com, where you can interact with a therapist virtually. But certainly if you're in urgent need of mental health support, please call the Aspen Hope Center or the Colorado Crisis Service. And then I just want to end on a brief note about what we've gained, because while we have lost a lot, we've gained quite a bit in the past year or so. So first, appreciation, gratitude for so many things and so many people. We've had some increased.
Hemos tenido un incremento, yo creo, de más creatividad.
We've become more flexible, hopefully. We've had more quality time with our immediate family. And the boom in technology and telemedicine has been extraordinary. I think telemedicine is likely here to stay, which is a good thing so that patients have choices on how they see their providers. And we've learned a lot. We've learned about this disease, applications that it may have for treating other infectious disease. We, for the first time, have mRNA vaccines that are extremely effective and will likely be used in other diseases such as West Nile and HIV. And we've learned really important public health lessons about how important it is for our public health departments to be fully staffed and funded. That is something we've traditionally not done well in this country. And I think we've learned the importance of that moving forward, I hope. And lastly, we've gained some perspective. I know personally for me, I've gained quite a bit of perspective on what's important and what is not important during this time. So with that, I will stop my screen share and answer any questions you have.
So Dr. Allen, we do have questions. I think some
Judy,
of them
I believe you are muted.
I am not. Can you hear me now? Can you hear me? Okay, great. That's, as I've been told, that the most common phrase in 2020 has been, "You're muted." So there I was. Okay, so you may have answered some of these in your presentations, but I'm going to say them anyway. So the first one is there anything that we as a community can be doing to help with pandemic efforts?
Okay, well, that's a great question. I would say the number one thing you can do is get vaccinated, because our ability to move about freely and do everything we want to do is directly correlated to how many of us get vaccinated. And we really need about at least 70% of the community to do that. We're well on our way. And especially because we now can vaccinate individuals 16 and up. So I would say that's the number one most important thing you can do.
Great. Second question. Was the vaccine rushed through? Is there anything I should be worried about?
Well, I think the Johnson & Johnson story is a good one, because what it shows you is that the FDA takes these side effects seriously, even when they're at an extremely low rate. The vaccine was not rushed through. It was given priority in terms of the planning for the clinical trials, obviously, but the same rigorous research methods and evaluations for efficacy, for side effects, were applied to all of those vaccine trials, just as they would with any other medicine that comes to market. So, I'm personally have never been worried about getting the vaccine, because I run a clinical research practice and I know how vigorous the trials are, and I did not see anything different happening with these trials. So personally, I do not believe they were rushed through, although I have heard that. I think they were just given priority.
Next question. What kind of protection do the vaccines offer?
Well, I think a lot of that depends on your personal situation and your personal risk. We know that some individuals are still more at risk. The cases that I mentioned earlier of the breakthrough disease despite vaccination occurred in high exposure areas. So I know one was someone taking care of a loved one at home with COVID, and despite vaccination, that person became infected. Another case that I'm aware of was an ER doctor who sees COVID patients all day. So that is also a high risk situation. But for the most part, we're looking at above 90% efficacy in preventing the virus. So I think that is far better than any flu vaccine we've ever had and is extraordinary.
Which vaccine should I get?
Well, right now your choices are Pfizer and Moderna, and those are both pretty readily available in all three of our counties. I would say that the vaccine you should get is the one that's available to you today. And I wouldn't worry about which one causes fewer side effects, because the difference is very, very minimal.
What does herd immunity mean?
So herd immunity is when enough people in our population have developed protective antibodies against the virus, that we are able to safely move around and do everything we used to do. That herd immunity doesn't come from necessarily from individuals who've had the disease, because not everyone makes protective antibodies when they get sick. And then those protective antibodies seem to be quite fleeting, only lasting a couple of months in some cases. So herd immunity is not something we would reach by all of us in the community getting sick, nor would we want that many people in the community to be sick, because our hospitals would be overwhelmed. But that number is probably around, with vaccination, somewhere between 70 and 90%, probably closer to 70%. And I think the jury is still out on what that number is.
How does COVID-19 affect children?
So most children have very few symptoms, or they can be completely asymptomatic. There have been almost 300 children in the US who have died from COVID, according to the American Academy of Pediatrics. And that's more than die from the flu, which is also a pretty serious pediatric disease each year. And then there is a pretty rare inflammatory condition that can
Inflamación bastante.
after COVID for children. The biggest thing I would say about that, though, is children represent this very unique situation with a virus, that for the first time we have people who get extremely sick and die, and then people who have no symptoms or very, very mild symptoms. And that makes COVID-19 and the associated virus a very unusual virus. And I think based on that, we have a lot to learn about what other viruses might be able to do and how to prepare for those. But yes, most children have very mild disease.
We have several more questions. Can you comment on the availability of proven antiviral medication and treatments in Colorado? We seem to be putting all discussions on vaccinations locally and nationwide. However, I have heard it reported that there is still significant disparity in the availability of infection treatment medications.
So that's a great question. I heard Dr. Fauci speak yesterday at the American Academy of Neurology meeting, and he talked quite a bit about the need for antiviral therapy. And obviously the race to the vaccine was important for worldwide economics and worldwide prevention of the disease. But I agree with the comment that the next step is to have really, really excellent antiviral therapies. And there currently really are two, resmetiviir and then another medication that was approved today for children. And the other medications have not done as well. But I do think that that's where we will see a lot of research money going now.
Next question. How long after getting my second dose do I remain immune? I will be 6 months past my second dose in July. Does that mean that I am susceptible to getting the virus, just as if I had not been vaccinated?
So yes, there is waning immunity over time, and Pfizer has come forward and said that in the last week, and that's not unexpected. But what we do know is that the individuals who are in the clinical trials for the vaccine are all about 2 to 3 months ahead of us, and they're still being evaluated. So anytime a medication or a vaccine comes to market, after that time period, the FDA and the sponsors continue to follow those subjects that are in the clinical trials over time, testing for residual immunity or any waning of that immunity. And so we will know before our immunity is up, we will know based on the clinical trial experience of those patients. Pfizer did come out and say that they believe a booster will be needed in 9 to 12 months from the second dose. And I would expect the same will be true for Moderna.
What exactly makes the variants more worrisome? Are there any unique symptoms with the variants?
That is such a great question. So if you look on the CDC, you'll see variants of concern and variants of interest. And variants of concern are ones that, based on current data, appear to be spreading more rapidly, especially sometimes in a pediatric population. And then the big question is always, does that change does the mutation of the virus also cause more severe disease? And so far, I don't think there's conclusive evidence of that. I think the biggest concern has been how rapidly it can spread.
Okay, that is the end of our questions. Unless, Alex, do you have any more questions that have come up on your end?
Not at the moment.
Let's give people another couple of minutes in case they would like to ask some questions, sorry. I don't see any more coming up. So with that, what I would like to do is thank everyone, particularly Alex Garcia Bernal at the library, Sue Zislis and Ron Kokish from Senior Matters, and especially our presenter, Dr. Brooke Allen. That was excellent. So thank you everyone for coming and joining us today. I hope it was very informative to you. It certainly was for me. And again, please go to the Senior Matters website or the Garfield County Library's website to see what new upcoming programs are coming in the future. Thanks very much.